This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Know Your Numbers. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous as always. Today's presenter is Dr. Tanzia Chowdhury. Dr. Chowdhury is board certified in family medicine. She received her medical degree from New York Institute of Technology College of Osteopathic Medicine and completed her residency at Peconic Bay Medical Center. Dr. Chowdhury practices family medicine at Mather Primary Care in Rocky Point and has a special interest in osteopathic manipulative treatment, which has been known to help patients find relief from muscle pain, migraines, and carpal tunnel. Dr. Chowdhury, go ahead and start us off.
Hello, everybody. My name is Alina Chowdhury. It's very nice to have you all here today. So today we'll be going over tests and screenings you might need, and these are some screenings that you would do at your doctor's office. So I'm going to go ahead and get started. For some reason, my screen isn't working.
Oh, just maybe click your mouse. There we go.
Okay, there we go. All right. So why do we need health screenings? The whole point of doing health screenings is so that we can find problems early and then we start to treat them. And it's so that you can live your best life possible. So there are many kinds of health screenings that we do. Your doctor might check your blood pressure, your blood sugar, your cholesterol levels, your body mass index, which is your height to weight ratio. They might recommend mammograms, colonoscopies, pap smears, testing for osteoporosis, lung cancer screenings, prostate cancer screenings, and many more. There are so many screenings out there. It wouldn't be possible for me to discuss all of them today, but we'll discuss some of the most common ones today. So I'm going to start with blood pressure. So what is your blood pressure? It is the force of your blood pushing against the walls of your arteries. When your blood pressure is too high, it means your heart is going to work harder. Now, high blood pressure can cause the heart to enlarge, or it can cause it to weaken, which then leads to heart failure. It can also narrow your arteries and disrupt the flow to your heart and your brain, which can lead to a heart attack or stroke down the line. So a good target for your blood pressure would be less than 120/80. Now, targets will differ for different people based on your risk factors. So again, before you decide on the right target for yourself, talk to your doctor. They will let you know what the best number for you could be. Another screening we do is we check your blood sugar at the office. Now, why do we check your blood sugar? So your blood sugar is the amount of sugar in your blood. So when you eat, your food is broken down by your body into glucose, which is a type of sugar, and then you absorb the sugar for energy. Now, when too much of this sugar builds up in your bloodstream, you can develop diabetes. So a good target for your blood sugar, if you're checking it or if your doctor is checking it, would be 80 to 130 before your meals and less than 180 2 hours after your meals. So we're going to go over different targets for blood sugar in just a second. So blood sugar is measured by a number called hemoglobin A1C. That's the amount of glycosylated hemoglobin in your blood. The A1C test gives you a picture of your average blood sugar control over the past 3 months. So when the A1C number is between 5.7 and 6.4, you are considered to be pre-diabetic. Now, being pre-diabetic can increase your risk of developing diabetes. So it's a number we keep an eye on. If you're pre-diabetic, your doctor may want to repeat this test every 3 to 6 months to make sure that the number isn't going up. Now, when the A1C is higher than 6.5, then you are considered to have diabetes. And your A1C target can again differ by age and your risk factors. But for most adults who do develop diabetes, the goal A1C would be less than 7%. Now, another screening we do is we check your cholesterol at the office. So what is your cholesterol? Cholesterol is a waxy substance that's found in your body cells, and your body uses it to make vitamins, hormones, and to build cells. Now, when you have too much cholesterol, this can build up inside your blood vessels. It can cause your arteries to harden and narrow, and that limits blood flow to your heart. So high cholesterol can increase your risk of heart disease and even heart attack. Now, cholesterol usually circulates in your blood in these little packages called lipoproteins. The lipoprotein has fat on the inside and protein on the outside. And there are two kinds of lipoproteins that carry cholesterol in the blood. And this is called your LDL and your HDL. The LDL, that's your low density lipoprotein. This is considered your bad cholesterol. It's carrying the cholesterol to tissues, including your arteries. So the higher the LDL level, the greater your risk for heart disease. Your LDL goals, again, can vary based on your risk factors. So a good number would be to be less than 100. If you're anywhere from 100 to 129, it could be near optimal or above optimal. And again, this depends on your risk factors, such as, have you had a heart attack before? Do you already have high cholesterol? So your doctor will let you know what they think is an appropriate target for you. And some other numbers would be, if the LDL is between 130 to 159, it's considered borderline high. If it's greater than 190, it's considered very high. So when you speak to your doctor, they'll let you know what your number should be. The other lipoprotein is the HDL. This is your good cholesterol. So the HDL absorbs cholesterol and carries it back to the liver, which then flushes it from your body. High HDL levels can lower your risk for stroke and heart disease. So a good goal would be above 40 for men and above 50 for women. Another thing that we measure would be your triglyceride levels. So the triglyceride is a fat-like substance in your blood. We all have them, but sometimes we can have too much. So when you have a high level of triglyceride, this can increase your risk of heart attack and stroke. It can also lead to inflammation in your pancreas, which is an organ that makes hormones and fluids to help your body break down food. Now, when you have an inflamed pancreas, it can lead to a serious problem called pancreatitis. And this can present with nausea, vomiting, abdominal pain, and usually requires hospitalization. So a good goal for your triglyceride would be less than 150. And another thing that we measure would be your body mass index. This is your height to weight ratio. So when you have a higher BMI, this is associated with obesity. It can lead to health problems like diabetes, high blood pressure, high cholesterol, heart disease, stroke, cancer, asthma, sleep disorders. So if your BMI is in between 25 to 29, you're considered overweight. And when the BMI is 30 or greater, you're considered to have obesity. So at your next doctor's appointment, ask your doctor, what's your BMI? What does your doctor think your BMI needs to be? What would a great target for you be? Typically, I prefer my patients to have a BMI less than 25. A great way to lower your BMI and your cholesterol levels is through exercise. And the goals for exercise currently from the American College of Cardiology, it's recommended we do about 150 to 300 minutes of moderate intensity exercise a week, or 75 to 150 minutes per week of vigorous intensity exercise. Now, exercise doesn't have to be fancy. You don't have to go to a gym. You don't have to lift weights. I just tell all my patients to start with a walking program. It's nice outside, it's summer. Grab your dog, grab a friend, and just go walking. Start by going walking for 20 minutes a day. Then you slowly increase to whatever you can tolerate. And some of the benefits of exercise include, it'll lower your risk of cardiovascular disease. It lowers your risk of many cancers, improves your mood, your bone health, and it also lowers your risk of falls or injuries. And again, before you start a program for exercise, talk to your doctor so we can make sure you're exercising safely. Another screening test you might be familiar with are breast cancer screening. So why do we do breast cancer screening? So about 1 in 8 women in the US will develop invasive breast cancer. and it's actually the most commonly diagnosed cancer among American women. And there are many different guidelines for breast cancer screening, and your decision to screen, it's going to depend on your age, your personal risk factors, and your family history. So the United States Preventative Services Task Force recommends mammograms every other year from age 50 to 75. Another group called the American Cancer Society recommends mammograms yearly from ages 45 to 54, or every other year from ages 55 and over. The American College of Radiology recommends mammograms yearly starting at age 40. So I know this can be very confusing. Different groups recommend different things. So there's really no right answer about when to get screened. Talk to your doctor about what's right for you, and it's really a personal decision. If you have a family history of breast cancer, you may choose to get screened earlier. There's no history, then you might choose to get screened later. So it's a great conversation to start with your physician. Another cancer that we screen for routinely is colorectal cancer. So this is the third most common cancer diagnosed in both men and women in the US. And since the mid-1980s, the rate of people being diagnosed with colon and rectal cancer each year, it's dropped because more and more people are getting screened. Now, the USPSTF, they recommend screening colonoscopy for all adults aged 45 to 75 years. Usually, colonoscopy is done every 10 years or so if your last colonoscopy was normal. If your first colonoscopy was a little abnormal, let's say they found a growth called a polyp, they might recommend you be screened again in 5 years. And then selective screening we do for adults who are aged 76 to 85 years, depending on your risk factors. So if you've had normal colonoscopies your whole life, usually it's okay for you to stop around age 75. But let's say your last colonoscopy was abnormal when you were in your 70s, or you have a personal history of colon cancer or a family history of colon cancer, your doctor might recommend you be screened as you get older into your 80s as well. Now, there are other tests available for colon cancer screening as well besides a colonoscopy. There are stool-based tests. So it's definitely another great point to bring up with your doctor to see if a stool-based test would be a good idea for you. Another cancer we screen for in women would be cervical cancer screening. So most cervical cancers are caused by human papillomavirus, the HPV virus. And this virus can be passed from one person to another during sex. There are many kinds of HPV, and only some types can cause cervical cancer. Other types of HPV cause genital warts or skin warts. There are 2 screening tests that can help prevent the cervical cancer. So we use a pap test or pap smear, which looks for precancerous changes, cell changes on the cervix that might become cervical cancer. This pap test can be done by your primary care physician or your OBGYN. We also do the HPV test, which looks for the virus, the HPV virus that can cause these precancerous changes. Now, screening for cervical cancer varies by age. According to the CDC, you can start getting your pap smears at age 21, unless a woman has HIV, then screening starts earlier. The CDC also recommends women aged 21 to 29 should be screened every 3 years. Now, there are also other groups that recommend screening at different ages. Certain groups recommend the first pap smear to be at age 25. And again, this is a decision that's made with your doctor based on your risk factors, your family history, your personal history. Now, for women who are aged 30 to 65 years old, there are a couple of options for screening. So you can do a pap test only. If the result is normal, your doctor might tell you to wait 3 years until your next pap test. You can do an HPV test. If this test is normal, your doctor might tell you to wait 5 years before your next screening test. And an HPV test can also be done along with the pap test. This is called co-testing. So if your results are normal, your doctor might again tell you that you can wait 5 years until your next screening test. Now, if they're abnormal, the intervals changes, and again, that's a decision that's made with your physician. Another screening test we routinely do is a bone density test to look for signs of osteoporosis. Now, osteoporosis is more common in women, and it can lead to broken bones in your hip, your forearm, your wrist, and spine. Some statistics: 1 in 5 women age 50 and over are affected by osteoporosis, and 1 in 20 men age 50 and over are affected. So screening for osteoporosis is recommended for women who are 65 years or older, and some women who are 50 to 64 years of age with certain risk factors should be screened. And some lifestyle factors that can contribute to bone loss are smoking, excessive alcohol usage, a sedentary lifestyle, or poor nutrition. Now, what are the screening recommendations for men? So that would be based on risk factors such as your age over 70 years, cigarette smoking, having a body mass index, that height to weight ratio that's less than 20, and a history of fragility fractures in the past, low dietary calcium intake, steroid usage, a history of spinal cord injury, or weight loss greater than 10%. So if this is you, another great question to ask your doctor: should you be screened for osteoporosis? Another screening that is typically recommended would be lung cancer screening. So lung cancer, it can begin in your lungs and spread to lymph nodes or other organs in your body, such as your brain. And risk factors for lung cancer include smoking, exposure to secondhand smoke, high radon levels in your home, a personal or family history of lung cancer, radiation therapy to your chest, or even exposure to certain substances such as asbestos, diesel exhaust, arsenic. And how do we screen for lung cancer, and who should be screened? So we screen for it using a low dose CAT scan. So it uses a very low dose of radiation. And it's currently recommended for people who are between the ages of 50 and 80 years old. If you have a 20-pack year or more smoking history, and if you either smoke now or you quit within the last 15 years. And I'm just going to define a pack year. A pack year is when you smoked an average of 1 pack of cigarettes a day for 1 year. Another common cancer that we screen for is prostate cancer. So the USPSTF, they recommend that men who are age 55 to 69 years of age make individual decisions about being screened with a PSA test. So this is a blood test. It's called the prostate specific antigen test. And it's not a perfect test. So when you're screening for it, the decision to be screened, again, it's a personal decision. So we weigh out the benefits and the harms of screening. Not everybody should be tested. Not everybody wants to be tested. So what are the benefits of screening? So you might find a prostate cancer that might be at high risk of spreading. So it can be treated before it's spread. And this can lower the chance of death from prostate cancer in some men. Somebody who might prefer to know what their PSA levels are if they have prostate cancer would want to be screened. But again, it's not a perfect test. So there can be some harms from screening. So you can get a false positive result. So the false positive can occur when a man has an abnormal PSA test, but does not have prostate cancer. And this false positive test can also lead to unnecessary tests, such as a biopsy of the prostate. This can also cause men to worry about their health. And older men, they're more likely to have false positive test results. There can also be some harms from diagnosis. So usually prostate cancer is diagnosed with a prostate biopsy. And a biopsy is when a small piece of tissue is removed from the prostate. And then you look at it under a microscope to see if there are cancer cells. So a prostate biopsy can cause pain. It can cause blood in the semen. It can cause infection. So those are some of the harms. Now, some harms from prostate cancer treatment could include incontinence, bowel problems, erectile dysfunction. So again, when deciding on whether or not to screen for prostate cancer, talk with your physician and really weigh out the harms and the benefits of screening. Not every person needs to be screened. Another thing we screen for is skin cancer. Now, there's no specific recommendation for or against routine screening to find skin cancers early, but this is a recommendation for those who don't have a history of skin cancer or any suspicious moles in the past. So a good thing to do would be to report any unusual skin changes, any new growths or lesions that are changing in color or size to your doctor, and then you can take it from there. So when should you do these screening tests? Usually once a year you might have a physical, so that would be a great time to ask your doctor about any screening exams you might need. But chances are your doctors have been recommending a couple of these tests to you every time you go in. So as always, have a conversation with your physician. And if you have any questions, I'm happy to take them now.
Thank you so much, Dr. Chowdhury. That was a great presentation. Like she said, if anybody does have any questions, there's a Q&A section at the bottom of your screen. Please feel free to click that open and we'll give it a minute or so for those questions. Dr. Chowdhury, if somebody did want to speak to you, about learning their numbers or want to make an appointment with you, you want to speak a little bit about that, making an appointment with you?
Absolutely. So I am located in Rocky Point. And I'm pretty much available 4 to 5 days a week. So give us a call. We have a call center that will make an appointment for you. So I see we have a question here. Somebody asked, are boys screened for HPV? So we don't routinely screen boys for HPV, but what we do recommend is the HPV vaccine. We started at age 10 and it can go up until age 26. So that's one thing you can do. Ask your pediatrician or your family physician if it's time to give your son the HPV vaccine. It's called the Gardasil vaccine. I hope I answered your question. Okay, we have another question. If your LDL is 99, should you medicate? Okay, so that's a tricky one. It would depend on what your other cholesterol numbers are. So we also look at your total cholesterol, your HDL, your LDL, your triglycerides. We look at your age, whether or not you have diabetes, whether or not you smoke, whether or not you have high blood pressure. Chances are if you have high blood pressure, you're a smoker, you're diabetic, you're older than 40, and you have high LDL, high total cholesterol, and your risk of heart attack or stroke is pretty high, then we would medicate you with cholesterol medication, usually a statin. But it's very hard to just answer, if your LDL is 99, should you medicate? It really depends on a lot of your other risk factors. We have another question. Will dieting and losing weight help to lower high blood pressure? Yes, it definitely will. So when dieting, I recommend a low sodium diet, less than 2 grams of sodium a day. Losing weight will definitely help lower your blood pressure. When losing weight, I always remind people to have realistic goals in mind. Don't go on like a crazy crash diet or anything. Half a pound a week is what I recommend to my patients. And again, you want to talk to your doctor about what your goal weight is and how you can get to that goal weight. Another question I have here, what else can you do for osteoporosis other than medications? All right, so if you are sensitive to medications or you decided you don't want to take medication, the best thing to do would be to take a calcium supplement, as long as you don't have a history of calcium-containing kidney stones. Also, exercise is great for osteoporosis. You want to do weight-bearing exercise as often as you can, and then take a vitamin D supplement. But again, talk to your doctor about your risk for fracture, what the result of your bone density testing was, and what you can do. All medications for osteoporosis are not all oral medications. If your stomach gets upset by oral medications, there are infusions you can do. There are injections. So there are many different kinds of medications out there. I think it's worth a conversation with your physician about what your options are. Okay. I have another question. If you are overweight, what do you think of diet pills? Okay, so, all right, it depends on the diet pills. I'm not a fan of all diet pills, especially not anything you get over the counter. If you are thinking of taking medications to lose weight, which we do prescribe for obesity, so if your BMI is greater than 30, your physician or your endocrinologist may recommend medication. It depends on the kind of medication that is used, what your risk factors are, and if it would be safe for you. So I know I'm not giving you a very straight answer here. What I'm going to say is it depends on the diet pill. If you told me the name, then I could give you a more specific answer. But if you are overweight, there are medications that can help you lose weight. If you're obese, the BMI is greater than 30, talk to your doctor. There are options out there for you. Another question I have, for men over 70, what prostate exam should be done if not the PSA? Men over 70 usually don't need prostate cancer screening, but again, speak to your doctor if you have a family history of prostate cancer or you're just worried about it, and we can do testing. Typically, the only test we do, the screening test, would be the PSA. Any more questions? I'm happy to answer them.
We have a couple more. I wasn't sure, did you see, what else can you, no, sorry. Is it usual that a woman's blood pressure may increase post-menopause?
It can happen. Now, as we get older, our blood pressure goes up anyway, just because you can have naturally occurring calcium deposits in your blood vessels. But your blood pressure can increase for a lot of reasons. One reason could be weight gain. Another reason could be your diet. The best thing to do is to keep a home blood pressure diary. Maybe check your blood pressure once a day when you're not stressed out, before exercising, before caffeine. You want to be sitting down, feet on the ground, back supported, with your arm at heart level. And then just track it around the same time every day, just once a day. Write those numbers down, bring it to your physician, and they can let you know if your blood pressure is dangerously high, if you need medication.
What actually takes place on a physical visit? I see several specialists, so I think I'm being screened annually, etc.
Okay, that's a great question. So a lot of things happen at your physical visit. First, we talk to you, we ask you what's wrong, is anything bothering you? We'll do a medication review, go over all of the medications that you're taking, make sure nothing is interacting with each other. We will actually examine you. So we'll listen to your heart, your lungs, we'll feel your lymph nodes, we'll examine your abdomen, we'll look at your legs, make sure there's no swelling. We take your vitals, we check your blood pressure, your heart rate, your oxygen level. And then we'll talk to you about screenings that you're due for. So we will definitely discuss with you if we think you're due for a mammogram, a colonoscopy. We'll let you know if we think we should check your blood, your cholesterol, your blood sugar. We'll do all the blood tests that are necessary. We'll talk to you about your vaccines. We'll ask you, did you have a tetanus shot in the last 10 years? When was your last flu shot? We go over your vaccination records. We do a lot of things, but most importantly, we talk to you and we discuss with you what your goals are. So it's really oriented towards the patient.
What is the formula that people use to check their BMI?
So you can find a really great calculator online. If you just go on Google and type in BMI calculator, it'll pop up with a little website and you type in your height and your weight, and it's the ratio.
What is a good at-home blood pressure machine?
I love that question. Okay, so if you go on this website, it's called validatebp.org. It lists a bunch of different blood pressure machines that are actually recommended by the cardiology associations. And they're different ranges of price points. So and most of them are very affordable. So then, you can just ask your pharmacist at CVS, or you can order online to see if they have that brand.
Okay, there's one more question here. It's got a lot of detail, so, feel free to, if you need to see them in person more, to answer something like this.
Okay.
What does Zetia, Z-E-T-I-A, do for your total cholesterol? I swim 3 times a week and my numbers are still not good. LDL 132, HDL 65, and total cholesterol 209. And they cannot take statins.
Okay, so Zetia can also help to decrease your total cholesterol. It's just another medication that acts on a different part of your body. All right, so you swim 3 times a week. That's great. Keep that up. That's excellent. Your numbers are still not good. So let's look at your numbers. Your LDL is 132. It's not terrible. Now for the LDL, there's no floor for the LDL. The lower, the better. Your HDL is pretty good. It's 65. So whether you're a man or woman, that's great. And your total cholesterol is 209. Usually the goal for total cholesterol is less than 200, but 209 isn't too far away from that. The best thing to do would be to keep doing what you're doing. You may want to talk to a nutritionist to see how you can change your diet to help lower that cholesterol a little bit more. But overall, I think these numbers they're pretty good.
Great. We'll give it just another second as we wrap up here if anybody has any further questions, because I think she hit a home run with all of these. Dr. Chowdhury, thank you so much for joining us today. Like she said, if you'd like to speak to her more or have any further questions, feel free to call her office. You can find her on Harborview Medical Services. She's at Mather Primary Care in Rocky Point. Thank you, everybody, for joining us today, and enjoy the rest of your day.
Thank you, everybody. Thank you for signing in today. I hope this was helpful to you. If you have any questions, I'm happy to answer them in person. Feel free to come see me at my office. I would love to speak to any of you. Thanks for coming today and have a great rest of your day.
All right, bye-bye.